since I wrote a book called Young Forever, where I really dove deep into the research on longevity. And I've been doing functional medicine for 30 years, so I've been doing a lot of
Can
this
you
stuff.
define functional
Yeah,
medicine? Because
sure.
I think,
Sure. What is functional medicine?
what is
So
functional medicine?
it's not a specialty. It's not a modality. It's not a test. It's a way of thinking about solving the puzzle of chronic disease. It's science of creating health as opposed to science of disease. In medicine, we have 120,000 diseases that we have in our diagnostic code book. And rather than thinking about labeling diseases based on their people's symptoms and where it is in their body, basically symptoms and geography, and you have arthritis, you have a joint pain, or you have a migraine, you have a headache, and you go to the neurologist. The body's not divided up like that. It's an ecosystem. It's a web. It's a network. The body's a biological network, and it's made up of sort of networks of networks. And so functional medicine is really about optimizing those functional biological systems. And when you look at the hallmarks of aging, it's a longevity science is kind of presented to us as sort of how the body works and how it degrades, functional medicine almost entirely maps across that. So we focus on mitochondrial function. We focus on inflammation. We focus on the microbiome. We focus on nutrition and nutrient sensing. We focus on a lot of the things that really are how we optimize our epigenome. So the way I actually help to optimize my health and reverse my biological age was focusing on the epigenetic reprogramming that we can do by various interventions. So what is the functional medicine approach? It's basically understanding how to optimize your biological system. So we get rid of the bad stuff, we put in the good stuff. The body has this innate ability to heal. So we have to sort of be very careful. Like, okay, what's the bad stuff? There's toxins, there's allergens, there's microbes, there's our microbiome that can go bad. There's poor diet, there's stress, and so forth. And there's things we're missing that we need to thrive. We need the right nutrients. We need the right whole kind of food, whole food. We need the balance of hormones that we need: light, air, water. We need movement, rest, sleep. And we need restoration, basically activating our parasympathetic nervous system. We need love, meaning, purpose. All these things are ingredients for health. And so we basically take out the bad stuff and put in the good stuff. And it can be a complicated process, but by doing that, we optimize these basic networks in the body, like the gut and the immune system and our mitochondria and our detox system and our circulatory transport system, our communication system, which is our hormones and our transmitters and cytokines, and our structural system. And so we basically approach the body as optimizing these 7 biological networks, which are all dynamically connected. And in doing that, we basically create health. And when you do that, disease goes away as a side effect. So that's what functional medicine is really. It's a systems approach. We call it systems medicine, network medicine. There's whole textbooks written on this from academics at Harvard. It's not a fringe idea, although it's kind of marginalized in medicine because the whole economic and educational system it promotes the propagation of the current model, which is a disease-based model that's fee-for-service, where the more you do, the more money you make, and not about getting better health or outcomes.
Right.
Yeah.
Right. So it's financially, I guess, it's not as incentivized as the current kind of broken system you're saying.
No,
So
right.
People kind of shit on it, for lack of a better word.
Right. Well, right now, I mean, if the way hospitals make money and doctors make money is to do more stuff, more procedures, more visits, more stuff. And
Pills.
so, like this woman, she, my goal is to put myself out of business. She didn't need me after she learned how to take care of her body and create health. She didn't need all the medications. She didn't need the hospital business. She didn't need surgery. She didn't need a kidney or heart transplant. I mean, thank God if we have that, if you need it, great. I've had back surgeries and I've had 2 heart surgeries for AFib, which was a genetic condition. Great. We need that stuff. But for most of the problems we're suffering from, chronic diseases are exploding. I mean, heart disease is, up over 50%. Cancer is up over 100%. We've got autoimmune diseases up over 100%. We've got Alzheimer's up over 100%. We've got psychiatric disorders up over 200%. We've got, so many increases in these chronic illnesses that are really because of the things we're doing to ourselves. So in answer to your question, what did I do myself?
What did you do?
What did I do? Well, I took a deep dive and understood how to optimize these hallmarks. So one thing I did was really optimize my diet. So I really made sure I had enough protein to build muscle, because muscle is the currency of longevity, and it's really critical to build muscle. So I make sure I have at least a gram per pound of ideal body weight a day.
You're 150.
Yeah, and it can be like 120 to 150. So it can be 0.7 to 1, which is far.
Most people take are more deficient in protein.
Yeah,
than
there's not like true protein deficiency. There's the way the guidelines work is, it says we should be eating 0.8 grams per kilo. This is what the dietary recommendations are, the RDA. Those are based on preventing a deficiency disease. So how do you not get kwashiorkor or marasmus, which are protein deficiency diseases that you get in the developing world? Yeah, you don't need that much. You need 0.8 grams per kilo of ideal, right? But if you want to build muscle for longevity, you need more. And especially as you get older, you need more. And so I added that in. I also added more strength training in, which is really important. And then I also did a number of things to help optimize my various systems. So, for example, I did a lot of treatments, for example, like plasmapheresis, which is a blood cleaning process. I did exosomes. I did rapamycin, which is a drug that I don't recommend for everybody, but it's a drug that inhibits this pathway called mTOR that causes autophagy or self-cleaning. So the body has a self-cleaning recycling process. And that if we eat all the time, we do all these things, we don't get it. And so the data is pretty good on this one as a molecule, one of the few molecules.
Supplement you take, or
no, it's a medication.
It's a medication.
Yeah, it's used in cancer treatments. It's used in immune suppression therapies for transplant medicine. It came out of Rapa Nui, which is an Easter Island, where they found this compound, and they thought it was an antifungal that worked well. They call it rapamycin because it's like erythromycin or something. And then they found it had immune suppressing properties when taken at high doses. But taking it at low doses intermittently, it actually helps to activate this autophagy process. It inhibits this pathway called mTOR, named after this compound, mammalian target of rapamycin. That's what mTOR is. And a lot of people in the longevity space say, we want to inhibit mTOR all the time, so we want to be vegan. That's the problem, because it's like anything. You need to breathe in, you need to breathe out. You need to be awake, you need to be asleep. It's like you need all of the balance. And so you need to both have autophagy and you need to induce muscle synthesis.